Who needs genetic testing for cancer and why?
Most people who have genetic mutations, as they're called, don't know that they carry them.
Dr. Holly Peterson is Director of Medical Breast Services at the Cleveland Clinic.
Family history can be a very strong clue, and there are certain red flags in families where we encourage people, especially people who have had cancer, to have genetic counseling and testing.
Red flags include people who have had breast cancer under age 50, breast cancer on both sides of the family with first diagnoses under age 50 to 59, patients with ovarian cancer, men with breast cancer, which is actually very rare, and breast and ovarian cancers in special populations.
Only about 5 to 10% of breast cancers are truly hereditary, meaning there's a change in the DNA that's passed from generation to generation, increasing one's risk.
Another important note, although BRCA1 and 2, the breast cancer genes, are what most of us think of when we hear the words genetic testing, there are other mutations.
There are colon cancer genes that are just as common, the Lynch syndrome genes that increase the risk for colorectal cancer and other cancers. There can be genes that increase the risk for gastric cancer, or even leukemias or sarcomas. But now there are more extended gene panels available, and we now test for 28 different cancer genes.
The actual testing itself is simple, a blood test with results coming back in 2 to 4 weeks.
If you're found to carry a genetic mutation, not everybody gets cancer. And we're learning more about risk factors that may play into who gets cancer and who doesn't get cancer, and certainly family history is very important. If breast cancer is very prevalent in a family, the patient may be at higher risk for breast cancer, but the patient's given information about all the risks and options, but definitely it's not 100%. I think many people worry about discrimination, and there was a federal law put in place in 2008 called GINA, the Genetic Information Non-Discrimination Act, which protects people from healthcare or job discrimination based on genetic information. And that's an important safeguard. We're learning more and more, and I think that that's important too, that this is really the tip of the iceberg. I think that genetics will make its way into all areas of clinical care, and people should view this as an opportunity to know more and be proactive.
For Fox 8, I'm Dr. Marc.